Cadaver as a first teacher. We'll see introduction, importance of cadavers, clinical correlation and ethical considerations. The word cadaver is to fall. A cadaver is a dead human body. The term dissect means to cut apart. Importance of cadavers. They play a crucial role in teaching anatomy and provide invaluable resource for learning, allows direct observation of various organs and tissues. No other method can replace this. Thus, cadaver is first teacher in medical school. Clinical correlation. Cadavers offer initial exposure to human body, enhances understanding of pathological conditions and anatomical variations, bridges gap between theoretical and clinical knowledge. Ethical considerations. Cadavers are treated with utmost respect. Cadaveric oath is taken, emphasizing dignity of deceased. The dead teach the living. Studying through donated cadaver is a privilege. Students should approach it with humility. Classification of synovial joints. Synovial joints are classified according to shape of articular surfaces, planes of movements, number of articulating bones. According to shape of articular surfaces, plane joints, hinge or gangliomous joints, elbow joint, pivot or trochoid joints, example median atlantoaxial joint. Condylar joints, example temporomandibular joint. Ellipsoidal joint, wrist joint. Saddle or cellar joint, first carpometacarpal joint. Ball and socket or spheroidal joint, hip joint. According to plane of movements, uniaxial, biaxial, multiaxial joints. Biaxial are condylar, ellipsoid or saddle joints. According to number of articulating bones, simple joints, compound joints, and complex joints, where the joint cavity is divided by articular disc or meniscus. Example, knee joint. Types of muscles and their differences. We'll see three types of muscles: skeletal, smooth, and cardiac, and differences. On basis of morphological and functional characteristics, three types of muscles are skeletal, smooth, and cardiac. Characteristic features of skeletal muscle: it is somatic or striated, attached to skeleton, and voluntary. Cardiac muscle is myocardium in the wall of heart, involuntary. Smooth muscle is non-striated in the wall of hollow viscera, it is involuntary. Skeletal muscle fibers are unbranched, cylindrical, multinucleated with cross striations. Cardiac muscle fibers are branched, cylindrical with intercalated disc, single central nucleus, and smooth muscle unbranched muscle fibers with spindle-shaped single central nucleus, no cross striations. Rhythmicity is absent in skeletal muscle. Nerve supply is somatic in skeletal muscle, autonomic in cardiac and smooth muscle. Stretch receptors and neuromuscular junctions present only in skeletal muscle. We'll see definition, location, structure and functions of sinusoids. Sinusoids are large irregular vascular spaces. They connect arteriole with venule or venule with venule. Location: liver, spleen, bone marrow, suprarenal glands, parathyroid glands. Structure: lumen is irregular and wide. Walls are thin, incomplete, made of endothelial cells. Large pores not closed by diaphragms contain phagocytic cells like Kupffer cells. Closely surrounded by parenchyma of the organ. Functions: allow sufficient time for exchange of substances between blood and tissue fluid due to irregular lumen and sluggish blood flow. Venous anastomosis. We'll see introduction, location, functions, and clinical correlation. AV shunts are direct connections between arteries and veins. They bypass capillaries, have thick muscular walls supplied with sympathetic nerves. Found in skin of nose, lips, external ear, mucous membranes of alimentary canal and nose, erectile tissue, thyroid, and tongue. Functions are temperature regulation, regional blood flow, BP regulation. Clinical correlation: during severe hemorrhage, AV shunts in kidneys and intestines open up bypass capillaries in kidneys, causing anuria. This ensures blood supply to vital organs, to heart and brain during emergencies. And arteries. We'll see definition, examples, clinical significance, and also functional end arteries. End arteries are the arteries whose branches do not anastomose with branches of other adjacent arteries. These are also called anatomical or true end arteries. Examples are central retinal artery, arteries of spleen, liver, kidneys, metaphyses of long bones, and central branches of cerebral arteries. If these arteries are blocked, the area supplied suffers from ischemia and later cell necrosis. Functional end arteries. These arteries anastomose at the level of arterioles. But if they are blocked, the tissues supplied become ischemic. Examples: coronary arteries and cortical branches of cerebral arteries. Of lymphatic system. We'll see introduction of lymphatic system, functions, components, direction of lymph flow. Lymphatic system is extensive network of lymphatic vessels and lymph nodes. It carries lymph and is accessory drainage system. Functions: drains excess tissue fluid 10 to 20%, absorbs fat from intestine, immunological defenses, and helps in fluid balance. Components are lymph, lymph capillaries, lymph vessels, thoracic duct and right lymphatic duct, lymphoid organs. Primary are bone marrow and thymus, secondary are lymph nodes and spleen, and epitheliolymphoid system. Direction of lymph flow is from lymph capillary to vessel, lymph node, lymphatic vessel, lymphatic trunk, collecting duct, and finally into subclavian vein. Thank you. Classification of neurons, Part 1. Neurons are classified as per 3 criteria: polarity, relative length of axons and dendrites, and shape of the cell body. According to polarity, they are pseudo-unipolar, bipolar, or multipolar. According to relative length of axons and dendrites, they are Golgi type 1 or type 2 neurons. According to shape of the cell body, they are pyramidal cells, fusiform or pyriform. Other types of neurons are stellate cells, glomerular cells, amacrine cells. According to function, sensory neurons, motor neurons, and interneurons. Sensory neurons carry impulses towards CNS found in dorsal root ganglion. They are unipolar. Motor neuron carries impulses away from CNS found in ventral root ganglion. They are multipolar. Interneurons are exclusively within CNS. Classification of neurons, Part 2. Neurons are classified as per 3 criteria: polarity, relative length of axons and dendrites, and shape of the cell body. According to polarity, pseudo-unipolar, only one process, example, dorsal root ganglia of spinal nerves. Bipolar neurons are found in retina and olfactory epithelium. Multipolar, most common type, found in peripheral motor nerves. According to relative length of axons and dendrites, Golgi type 1 neurons have long axons, example, Purkinje cells of cerebellar cortex. Golgi type 2 neurons have short axons and star-shaped. According to shape of cell body, pyramidal cells in motor cortex of cerebrum, fusiform cells in motor cortex of cerebrum, pyriform cells, Purkinje cells of cerebellum. Other types: stellate cells of cerebellar cortex, glomerular cells, granule cells of cerebellar cortex, amacrine cells in retina. Neuroglia, Part 1. Let's study introduction, structure, classification, and functions of neuroglial cells. Neuroglia provide structural and functional support to neurons, do not propagate nerve impulses, 5 to 10 times more numerous than neurons, and constitute more than half of brain's weight. Structure: highly branched, occupy spaces between neurons, and provide suitable microenvironment for neuronal activity. Classification: according to structure, microglia and macroglia. According to origin, microglia are derived from mesoderm and macroglia neuroectoderm. According to location, CNS, astrocytes, oligodendrocytes, ependyma, and microglia. Peripheral nervous system, Schwann cells and satellite cells. Functions. Provide structural and functional support to neurons, form blood-brain barrier, phagocytosis, produce cerebrospinal fluid and myelination. Neuroglia Part 2. Let's study neuroglia in CNS, that is astrocytes, oligodendrocytes, ependymal cells and microglia. Astrocytes are largest and most numerous. They are star-shaped cells with many dendrite-like process. Terminal ends form food process. These surround capillaries and form perivascular sleeve. Sleeve and capillary endothelium form blood-brain barrier. Types: protoplasmic astrocytes in grey matter, fibrous in white matter. Oligodendrocytes are smaller than astrocytes. They have fewer cytoplasmic process, form myelin sheath around nerve fibers in CNS. Ependymal cells line the ventricles of brain and central canal of spinal cord. Microglia are smallest neuroglial cells. Their function is phagocytosis and they are derived from mesoderm. Neuroglia Part 3. Let's study neuroglia in peripheral nervous system and clinical correlation. Satellite or capsular cells. These surround cell bodies of neurons in sensory and autonomic ganglia. They provide structural support and nutrition to neuronal cell bodies. Schwann cells, also called neurolemmocytes, form myelin sheath around peripheral nerve fibers. They also form neurolemma around all nerve fibers of PNS. Clinical correlation. Gliosis. It occurs in response to infection, trauma or stroke. Microglia migrate to damaged area and perform phagocytosis. Damaged neurons are replaced by proliferating astrocytes. This process is called gliosis. Glioblastoma multiforme is most fatal brain tumor, arises from astrocytes, very poor prognosis. Life expectancy is 2 to 3 months. Topic is typical spinal nerve Part 1. Let's study introduction, roots, formation and division, posterior and anterior ramus. Typical spinal nerve is formed by two roots, anterior and posterior. These emerge through intervertebral foramen, and spinal nerve is a mixed nerve. Roots. Anterior or ventral root is motor in function, arises from anterior on cells. Posterior is sensory in function, contains dorsal root ganglion. Anterior and posterior roots unite to form nerve trunk, which divides into posterior and anterior ramus. Posterior ramus curves backward around the vertebral column, supplies deep muscles of back and skin, divides into medial branch and lateral branch. Anterior ventral ramus runs anterolaterally around the body wall, supplies the muscles and skin. In thorax, it supplies intercostal muscles. Branches are lateral cutaneous nerve and anterior cutaneous nerve, which supply the skin of thoracic wall. It's typical spinal nerve Part 2. Let's study gray ramus communicans and its sympathetic distribution, white ramus communicans, plexus formation. Gray ramus communicans. Soon after formation, ventral ramus receives gray ramus communicans from sympathetic trunk ganglion. It contains postganglionic sympathetic fibers. Sympathetic distribution, blood vessels, sweat glands, erector pili muscles. White ramus communicans is present in all thoracic nerves and upper two lumbar nerves. Connects ventral ramus to sympathetic ganglion. Has preganglionic sympathetic fibers which arise from lateral gray horn cells. Relay in sympathetic ganglion. Plexus formation. Except thoracic nerves T2 to T12, ventral rami form plexus. Major nerve plexus, cervical plexus C1 to C4, brachial plexus C6 to T1, lumbosacral plexus L1 to S3. Differences between sympathetic and parasympathetic nervous system. Sympathetic nervous system arises from lateral gray column of T1 to L2 segments, thoracolumbar outflow. Parasympathetic arises from visceral efferent nuclei of 3rd, 7th, 9th, 10th cranial nerves, S2 to S4 sacral segments, craniosacral outflow. All parts of the body, somatic and visceral, receive sympathetic, and sympathetic stimulation helps body energy to fight or flight. Parasympathetic supplies only viscera, helps the body to conserve energy. Preganglionic fibers are short in sympathetic and longer in parasympathetic. Neurotransmitter is adrenergic in sympathetic, cholinergic in parasympathetic. Sympathetic nervous system dilates pupil, slows peristalsis, increases heart rate and respiratory rate, vasoconstriction, bronchodilation, pilomotor, pseudomotor. Parasympathetic nervous system constricts pupil, accelerates peristalsis, decreases heart rate and respiratory rate, bronchoconstriction. Topic is miscellaneous laws. We will study Hilton's law, Wolff's law, law of ossification. According to Hilton's law, the nerves supplying the joint also supply the muscles that regulate the movements of this joint and also the skin that is present over this joint. Wolff's law, also called trajectory theory of Wolff. According to this law, the bone formation or osteogenesis is directly proportional to the stress and strain applied. Law of ossification, also called law of union of epiphysis. The epiphyseal center or secondary center of ossification, which appears first, unites last, and the epiphyseal center, which appears later, unites first. This law is violated by fibula, where the epiphyseal center for the lower end appears first and unites first, and for upper end appears later and unites later.